Hello and welcome back for a webinar on anatomy of face. We have completed first part of anatomy of face in last week, and during that time we have studied the boundaries of the face. I mean the definition of face, the boundaries of face, and the muscles of facial expressions. The most important part of the anatomy of the face is muscles of facial expressions. It is commonly asked in exams. And plus, it is also required for us to know various expressions and which muscles bring in those facial expressions, what we call as emotions. Hope you remember all that stuff today because after a gap of a few days, we have come back for episode 2 on face. And today we have to complete the remaining part of anatomy of the face as far as the what we call blood supply, venous drainage, lymphatic drainage, nerve supply, and all that stuff we have to finish, plus the clinical anatomy of the face. That also we have to complete today. So I welcome you for the second episode on anatomy of face. Well, here we go. Anatomy of face part 2. And look at this GI. We don't call it as a face, we call it as a face mask. We get lots of face masks in the market, different fancy face masks, which are usually used for the purpose of arts and for the purpose of various, reasons. Well, the first part which we are going to study is the different wirings which are present on the face. I mean to say wirings means all those elongated thread-like things like arteries, veins, nerves, lymphatics. That we are going to study first today. Let me go for nerve supply of the face first. Now, nerve supply for the face is required for two purposes. For the purposes of movements of facial muscles, for the purpose of expression, and also for the purpose of sensations on the face. So sensations on the face are all general sensations. We don't have any special sensation on the face. We're not required. No? Only we are talking about the face. And for face, we require pain, touch, temperature, hot, cold, pressure, proprioception. And for that purpose, triseminal nerve is the only nerve which is meant for the sensory supply to the face. Okay, trigeminal nerve has got three branches: ophthalmic, maxillary, and mandibular. Mandibular is mixed branch. It also contains motor root. So these three of them, they are sensory to the face: all pain, touch, temperature, pressure, proprioception. And for the purpose of motor nerve supply to the face, we have a facial nerve that I told you during the time of study of muscles of facial expressions. And facial nerve is a cranial nerve number 7, and trigeminal nerve is a cranial nerve number 5. So 5 and 7, these are the two nerves which supply the face as far as the nerve supply is concerned. Okay. Well, let us proceed further. Here you can see the motor nerve supply to face, and here I am showing you the facial nerve and its branches. This image is very important for you to write facial nerve if it is asked in exams. And facial nerve has got 5 branches. You can see 1, 2, 3, 4, and 5. Okay, so these 5 branches, you can also put your hand on your face like this, and you can show all these 5 branches. The lower one has to come to the neck, so it is called as cervical. So likewise, you can show like this. So middle one will will come in the buccal area. So accordingly, they are named. So we'll see these branches names of facial nerve. You can see this hand. Here the hand, somebody has put hand on the face of someone else. You can show it on your own face also. The thumb will go up now, and the little finger will come on the neck. You can show branches like this on your face. And this is very essential for the examination as well as for clinical purpose. Okay, especially the facial paralysis, what we call. So these are the branches of facial now. The first one is temporal branch because it is in the temporal region. Second one comes in the zygomatic area. So it is called as zygomatic branch. Then buccal we have buccal branch. Buccal branch is in the cheek. Cheek. So bucca is the area of cheek. So buccal branch. But buccal branch we have uh, two branches, upper and lower buccal branch. But for the sake of understanding, we count them as a one because we want to have a 5 branches later. Then fourth one comes on the mandibular area, so it's called a mandibular branch. And the fifth one comes in the cervical area. Okay, so it is called a cervical branch. So temporal, zygomatic, buccal, mandibular, and cervical. These are the 5 branches of facial nerve. The facial nerve here is emerging out of the parotid gland. Okay, so we are going to study parotid region in a separate topic. But for today, you understand the facial nerve and its branches, and which are the muscles which are supplied by the by all these 5 branches of facial nerve. For example, temporal nerve supplies which facial muscles. Okay, so in the temporal area we are in the temporal area. So there is a frontalis and there is a auricularis. Auricularis is on the auricle, ear pin. Okay, I told you that it has got 3 parts. We count it as a 1. Frontalis, auricularis, and orbicularis oculi around the eye. Zygomatic will supply orbicularis oris around the mouth. Buccal will supply the muscles of the cheek and muscles of the upper lip. Here the muscle names are not given. So muscles of the lip means all those labii, and buccal means buccinator on, and the muscles around the buccinator. Now this marginal mandibular is also called as marginal mandibular because it is on the margin. So it supplies the muscles of the lower lips called depressors. So elevators are supplied by the buccal and depressors are supplied by the mandibular nerve. Now cervical branch supplies platysma. Platysma is a flat muscle present on the neck. So altogether there are 22 pairs of facial muscles. Okay, means they are on each side 22 that we have completed, and all are supplied by these 5 branches of facial nerve. Now we'll go to sensory nerve supply of face. As I said in the beginning, that sensory supply to the face comes from 5th cranial nerve, that is triseminal. The triseminal nerve has got 3 branches. The sensory root has got 3 branches. Okay, motor root has no branches. It goes with the mandibular root of the sensory portion. Then you can see a picture here. So greenish portion is all supplied by the ophthalmic branch of 5th cranial. We call it as phi 1. So this is not V, this is 5. 5th cranial nerve, branch 1. Now this is phi 2. It's all blue area, which is called maxillary area, supplied by the maxillary nerve. And this is all pink area supplied by the mandibular nerve. So phi 3. Okay. Plus superficial cervical plexus supplies the cervical area as well as portion behind the ear, as far as the sensory nerve supply is concerned. So the main sensory nerve supply to the face comes from 5th cranial nerve through all of its 3 sensory branches: ophthalmic nerve, maxillary nerve, and mandibular nerve. Well, you can see in this image once again the trigeminal nerve sensory root is big and it is divided into 3 parts. And once again I am telling you, there is a motor root which doesn't get divided. It goes with the mandibular part of trigeminal nerve. Okay, so ophthalmic nerve supplies, ophthalmic division of the trigeminal nerve supplies this area around the nose. Maxillary division of trigeminal nerve supplies all this maxillary area. Mandibular division of the trigeminal nerve supplies all this mandibular area. Plus greater auricular of cervical, greater auricular nerve of cervical plexus supplies this portion below the mandible and around the neck, cervical area. Now here you can see the ophthalmic division and its further branches. Supraorbital nerve, supratrochlear nerve, lacrimal nerve, infratrochlear nerve, and external nasal nerve. So if you remember these branches of ophthalmic division is well and good. Now maxillary division gives these branches, important branches. Zygomatico-temporal nerve, zygomatico-facial nerve, and infraorbital nerve. Okay, so depending upon their name, the area allotted to them is supplied by them. So infraorbital means below the orbit. Okay. Now mandibular division has got these three branches: auriculotemporal nerve, buccal nerve is for the cheek, and mental nerve. Mental nerve is in the for the mental area, the central portion of the mandible. Okay. Now greater auricular nerve comes from the cervical plexus. We can see a greater auricular nerve coming over the sternocleidomastoid nerve. Sorry, sternocleidomastoid muscle. This is a muscle, big muscle here. Sternocleidomastoid. Above that, it is placed greater auricular nerve. So it supplies this area for sensory purposes. Apart from these nerves, there are numerous cutaneous nerves present on the face. Cutaneous means the nerves which supply to the skin. Cutaneous. There are so many cutaneous nerves in the body. We are talking about cutaneous nerves of the face. You can see the cutaneous nerves. Supraorbital, supratrochlear, infratrochlear, external nasal. Those nerves are the branches of all three divisions of triseminal nerve. Okay, now we have seen those. Zygomatico-temporal, zygomatico-facial, infraorbital. So mandibular gives auriculotemporal, buccal, mental, and plus greater auricular. Now greater auricular is having root value C2, C3. C2, C3 means cervical second and cervical third, because that is not a cranial nerve, it is a spinal nerve. So cervical plexus is formed by the spinal nerves from cervical area. So cervical, we have 8 cervical nerves, C1 to C8. Out of that, C2 and C3, they form greater auricular nerve. That was all about the nerve supply of the face. Now we'll go to the arterial supply of the face. So blood supply to the face through the arteries. The arteries taking part in blood supply to the face, that we will study now. You can see here the major artery to the face is of course facial artery. Okay. Earlier also I have told you that facial artery is the branch of external carotid. So it is the chief artery of the face, or the main artery of the face. Well, branch of external carotid artery. So it is a branch of external carotid artery which comes from carotid triangle just above the level of the tip of the greater cornea of hyoid bone. From here it comes to the face. The cervical course submandibular region and enters the face. So neck through from neck area to submandibular region to face. We can see facial artery here. So here the common carotid artery of one side is shown to you, which divides into external carotid artery and internal carotid artery. Internal carotid artery will go in the cranium for blood supply to brain, and external carotid artery will supply the part of upper part of neck and the face up to the head. You can see lingual artery, facial artery, maxillary artery, superficial temporal artery, occipital artery. These are all branches of external carotid artery. Out of that, we are talking about facial artery first. So this is the facial artery going on the face. Well, what is the course of facial artery? Facial artery comes at the base of the mandible first, then it enters into the deep cervical fascia in the anterior-inferior angle of masseter muscle. And here it can be palpated, okay? And it is palpated here. It is palpated easily here. So it is also called as anesthetist artery, because during anesthesia, the anesthetist sits by the side of the patient during surgery when the anesthesia is given, and he wants to easily palpate some artery. So he can place the artery and his fingers on the facial artery and palpate it, so he can understand the rate of pulsations as far as the patient's condition is concerned. Then it runs upwards and forwards 1.25 centimeter lateral to the angle of the mouth. So this is angle of the mouth. 1.25 centimeter lateral to the angle of mouth. The exact in the surface marking, you should remember all these points. Then it ascends by the side of the nose, from side of the nose here, up to the medial angle of the eye here, and terminates in the lacrimal sac. So it also anastomosis with nasal branch of ophthalmic artery. So ophthalmic artery is another artery. So through its dorsal nasal branch, it anastomosis. Anastomosis means communicating with other artery. Here you can see the facial artery, lower border of the mandible, and here you can see it is a tortuous in what do you call shape. So it is a tortuous. Okay, tortuous means like what do you call a spring, tortuous. And because we have to open the mouth, then it has to get stretched. For that purpose, there is a tortuosity of the artery. Now the branches of this facial artery will see in short. Inferior labial arteries or inferior labial artery. Labus or labi, these are related to the lip, the Latin words for lip. So for lower lip. Superior labi for upper lip, antero-inferior nasal septum as well. And lateral nasal is for the ala of the nose and dorsum of the nose. So these all areas supplied by the facial artery. Now another important artery on the face is superficial temporal artery. Superficial temporal artery is also a branch of external carotid artery. Okay, so you can see the superficial temporal artery. Usually in front of the ear auricle, you can feel the pulsations. You can feel the pulsations here also and there also. So I told you about anesthesists. They try to palpate this artery or even this artery. The hands are little away from the sitting position of the anesthetist. Easily they get these arteries to palpate it. Okay. Other small arteries are also there on the face apart from these two arteries, and that is all about the blood supply of the face. Remember, superficial temporal artery and the facial artery, both are branches of external carotid artery, important part of the face. Now, what is the venous drainage of the face? So, veins accompany the arteries and they drain into common facial retromandibular veins. Okay, and W-shaped arrangement we can see in the venous drainage. Facial vein is the largest with no walls. So corner of W, so W is the shape given by the venous drainage of the face, prolonged upwards into the skull and downwards into the neck. So what is this W? You can see here. Okay, and this is the arrangement of what you call venous drainage of the face. You can remember all these veins. This is the major vein, like facial vein. You can see here. Okay, you can see facial vein. Well. The facial vein begins as angular vein at medial angle of the eye. Medial angle of the eye is here. Formed by the union of supratrochlear and supraorbital veins. So veins are formed by the tributaries. Veins do not have branches. They are having tributaries. So supratrochlear and supraorbital veins are the tributaries of facial vein because they are the two which forms the facial vein. Then angular vein continues as facial vein running downwards and backwards behind the facial artery, straight course. So straight course behind the facial artery. Now in this you can see facial artery shown in red color and facial vein is shown in blue color. So see the course of facial artery and the course of facial vein. Facial vein is straight, whereas facial artery is having curves. Well, these are the different arteries which form these arteries. Plus, you can see the formation of common facial vein here by external, what you call anterior division of ventromandibular vein and facial vein. Okay. Here you can see the supraorbital vein and supratrochlear vein forming the facial vein. Facial vein is also having tributary superior ophthalmic vein. Then you can see the angular vein here. Then you can see the facial vein proper here. Then you can see the deep facial vein here. Okay. Now we'll go to lymphatic drainage. Wow, what a beautiful image of a face. Very nice. This face image looks very nice. Well, here you can see the superficial parotid or periauricular lymph nodes. The lymph nodes which drain the face, periauricular. Periauricular means, sorry, not periauricular, preauricular. Preauricular means before auricular, in front of auricular. So this is auricle, this is preauricular area. And it is also called as superficial parotid portions because parotid located here. That is why they are named as superficial parotid lymph nodes or preauricular lymph nodes. So now they drain most of the area of the face from upper side. Submandibular lymph nodes, they drain this area from the side of the face, buccal area. And submental lymph nodes drain the lower lip and the area below the lip. So these are the three areas of lymphatic drainage. So depending upon lesion on which part of the face, we can decide the lymphadenitis or the affection of the lymph nodes. Okay, if the submandibular lymph nodes get involved, get inflamed, we have to take what you call examination of this portion of the face, buccal area up to maxillary area as well, lateral part of the nose. So this is the lymphatic drainage of face in short. Now we'll go to the applied anatomy, that is clinical anatomy of the face. Why we are studying face? Because we come across clinical conditions or diseases of the face, what we call. So let's start to understand one by one. First one is triseminal neuralgia. Okay, now triseminal, because the triseminal is the main sensory nerve to the face. It gives three branches, and that is why in any branch of the face can lead to this neuralgia. Neuralgia means pain along the course of nerve. Okay, so it is a painful condition when the trigeminal nerve is involved. Okay. Another is Bell's palsy. Bell's palsy is also called as facial paralysis or facial palsy, in which the one side of the face get paralyzed due to lesion in the facial nerve. Facial nerve is a motor. So paralysis means loss of motor function on one side. That is the one nerve. Usually one nerve gets involved, gets affected, and in that case, what will happen to the face? The picture here is clear, and you can see that there is a smoothing out of forehead. So forehead becomes smooth. Eyebrows on the side of paralysis get droop, and drooping of corner of mouth is also seen. So if this face is affected, you'll find these three signs on the face. We call it as a Bell's palsy. Due to intranuclear lesion in the facial nerve, you get Bell's palsy. Affected side is motionless. It doesn't move because there is a motor loss. And there is a loss of wrinkles because muscle don't move, face becomes smooth, no wrinkles. Eyes cannot be closed because orbicularis, levator palpebrae superioris or the orbicularis oculi is around the eye, and that gets paralyzed. Smile causes deviation of mouth to one side. The affected person smiles, see the deviation. So it will deviate to one side. The deviation is towards the normal side because normal side muscles they pull, and the affected side the muscles cannot act. And the mastication, that is mastication means chewing. Okay, because we are going to study muscles of mastication tomorrow itself. So muscles of mastication, accumulation of food in the vestibule of the mouth between teeth will remain there. So there is a problem in what you call taking the food inside. That is why it's called as accumulation of food at vestibule of the mouth. This happens in Bell's palsy or facial paralysis. Well, here you can see inability to close eyelid. Now this lady is having a Bell's palsy of her right side. This is the right side. Okay. So drooping of the mouth you can see on the right side. This is the acting properties of the this corner is pulled up. Okay. Inability to close eyelid, drooping of the mouth is shown clearly in this image. And my dear students, another important aspect of the mouth is to know the dangerous area of the face. So this triangle, okay, right from your root of the nose, labial artery to the lower lip, we call it as a dangerous area of the face. Immediately after, above, behind that and above also, there is access to the brain. So injuries in this area may lead into, infections to the brain. So this is a dangerous area of the face. Okay. And with this, my dear students, we have finished the anatomy of face uh, in toto. Okay. So actually, muscles of facial expressions has to be emphasized more, and that is why just try to make out the answers by looking at this image, what this one stands for, what this two stands for. Okay, हे तू जरा इकडे सरकवून घ्या, हा जो मसल आहे ह्याचं ठेव. For example, this muscle shown here is a temporalis muscle. Now this temporalis muscle is not a muscle of facial expression, it is the muscle of mastication that we are going to study tomorrow. Plus this four number muscle, this strap. This is also not a muscle of mastication, sorry, a muscle of facial expression. It is a muscle of mastication, masseter. So temporalis and masseter, they are seen on the face, but they are not muscles of mastication. They are muscles of, sorry, they are muscles of mastication, not muscles of face. काय गोंधळ चाललाय कधी कधी. A lot of disturbances come on the internet. So temporalis and masseter, they do not come in those 22 muscles which are muscles of facial expression. Whereas you can see this muscle which is getting inserted on the masseter. You can see the insertion of masseter. So this is the rhizorius. And above the rhizorius, you can see the 5 number muscle shown here. The buccinator. So buccinator is a muscle of facial expression, but it also helps in the mastication. So it is also called as accessory mastication muscle. So muscles of mastication are 4: temporalis, masseter, and from inside medial pterygoid and lateral pterygoid. These are the 4 primary muscles of mastication. But there are accessory muscles of mastication as well. So in that, this buccinator falls. So there is no clear-cut line, but we have to differentiate these muscles into different categories. This 6 number muscle shown here is the orbicularis oris, and third is orbicularis oculi. Okay, now 7th muscle is shown on the muscles of neck. So muscle which is present behind the sternocleidomastoid. So this is not a muscle of muscles of facial expression as well as muscles of mastication. This is another muscles of the neck in the posterior triangle of the neck. So we'll come to the triangles of the neck in the study of neck when we reach there. So I hope that you have understood the anatomy of face as far as the gross anatomy of face is concerned. And if you have any questions, you can ask me. Otherwise, I'll come back to you for questions. And with this happy face and the dancing face, let us end today's webinar on anatomy of face. Thank you. Thanks a lot. See you tomorrow again with a new topic, and that is muscles of mastication. Thank you for listening me patiently. Have a nice day ahead.